Hello, it's Ralph Hills. I live in Connecticut, near New York City in the United States. I have been in treatment for 12 years. I'm very fortunate to still be here. I'm also the patient chair of Know AML in London. For the first 2 months, not accepting how serious my diagnosis was, I asked my wife to limit sharing information outside the family. We did tell our daughter and young grandchildren that I had an illness and was getting treated. Looking back, it is probably impossible to eliminate the fear loved ones might have. But when we thought this may be a fatal illness for me, my wife started a newsletter, which grew to everyone we knew. At the lowest point, 6 months into my treatment, when I looked quite bad at losing 45 pounds, people came from afar, and we actually had last visit type time together. Over the years, I've seen so many times when a patient of any illness shares their story in a personal or public way, sometimes quietly or maybe even with social media.
I'm Anna Mamwell. I'm a Know AML Ambassador and I'm in the UK. I was diagnosed with acute myeloid leukemia, AML, in 2015, and I had a few months of treatment, and then now I've been in remission ever since. I'll just share what happened actually with myself and my daughter, because I think that's quite an important thing, and I do tell people this. She was 8 at the time when I was diagnosed, and the diagnosis happened very suddenly. So there was no preparation. It wasn't like I was ill for a long time before and those sorts of things. So I was rushed into hospital, and after we'd been given my diagnosis, me and my husband, he brought my daughter into hospital. I think it was the next day, and she next to my bed, and I just said to her that I'd got leukemia, and that I'd have to be in hospital for a while, and the doctors would be looking after me. Now, the reason why I used the word leukemia and not cancer was because in my mind, I felt she wouldn't really understand what leukemia was. So therefore, she wouldn't be scared because she knew what cancer was roughly, because we'd had a few experiences in the family. So that was my way of kind of telling her to sort of as gently as possible when it is quite difficult. And I remember also the Macmillan nurse advising us, because we'd asked them, how do we talk to our daughter? And they had said, don't lie to them and don't keep things from children, because they pick up on things and they hear bits of conversations, and they also then start to feel like they've done something wrong if people suddenly stop talking when they walk in the room. So we took that on board, and that's why we told her that I had leukemia. But like I say, I was a bit scared, obviously, so I did it in that way. So fast forward just 2 days, and she came in to see me again, and she sat down and she said to me, "You've got cancer, haven't you, Mummy?" So that just highlighted to me that she picked up on things. She was far more tuned into things than I realised, and I couldn't hide anything from her. And I always remember that moment, and obviously we talked from then, but it was quite an eye-opener, because it was like, yeah, don't underestimate what they know and what they want to hear. And then another incident happened with my cycles of treatment where I had to have an extra one, which we didn't plan for, an extra cycle of treatment. And I didn't tell her straight away either, because I'd promised her that I'd finish with my treatment and we'd have some good time together. But I did tell her, obviously, ultimately, because I'd have to go back into hospital. And she said to me, "I knew something was wrong with me." So again, that highlights that what the Macmillan nurse and everyone had said is like, don't hide things and don't lie. But obviously there's a way of doing it. You can use language that is appropriate for the age and appropriate for that child. So that was just how our experience of telling my daughter. With everyone else, similar to sort of the things that Ralph has come up with, my mum started doing an email update to lots of people every time there was an update, because there was so many people that were cared about us, that were worried and wanted to know. So rather than having to have lots of phone calls, lots of individual messaging, they did it like that. And also my husband and sister used Facebook to update people, because there were loads of people here in my local town and my local area, and even as far as the US that I knew, that were wanting to know how I was getting on. So they handled all that, which was nice for me and my husband, really, because it took a little bit of pressure off us. I mean, it's lovely that people care and they want to know how you are, and the messages do really help. So I would say, to anyone that's got a friend or family member of somebody going through it, is, do send those messages. You may not get a reply, because I was not able to reply all the time, but I did read them and it really, really helped me. So that would be something else I would say. And I think it is one of those conversations like I had to have with my employer, and I had to have with a group of friends. It's not an easy conversation, but it's not something you can hide either. So, and don't worry about it. At the end of the day, you're the one going through it, and you're close, family and friends. So, I think everyone handles it different, and some people don't like to tell people, but I think we had such a mass outpouring of love and support that helped us through it. So, I'm so glad that we did inform people. And the timescales I'll just mention briefly, because if I was rushed into hospital, and in my town, it's a small town, people were then not seeing me do the school run. My work colleagues, but I knew I wasn't at work, so you can't really hide it. It's something that everyone sort of does get to know within a short space of time, really, for us here.